The SIRONA trial is actually a head-to-head comparison, and the really very first head-to-head comparison of Sirolimus DCB against against the whole group of Paclitaxel drug-coated balloon angioplasty. And the reason is actually that Paclitaxel DCB in the treatment of claudicants in the femoropopliteal artery, it's the standard of care. Everyone accepts that's the standard of care, very effective treatment, long-term patency, and but still there should be also the question, there's still the debate on the safety of DCB coated with Paclitaxel, not only for the Castanos discussion of all-cause mortality. We also have seen this in our own meta-analysis that there is a certain signal of all-cause mortality, but I think there are other reasons why Paclitaxel has some limitations. And first at all, the main limitation is that we are seeing a higher rate of limb amputation on the long-term use of Paclitaxel, and also if you have, and it's so effective that it also destroys the whole vessel wall, meaning even after stent implantation, you might have stent migration, you might have aneurysma in the femoral arteries, and these are, I think, limitations so that we should think about an alternative. Yeah, this is a randomized controlled trial with a one-to-one randomization of the MagicTouch Sirolimus coated balloon against a group of DCBs, altogether 7. And we recruited in a one-to-one randomization 482 patients. And we are now looking at the 12 months results and the primary endpoints. The key findings, first of all, I don't start with a secondary, I would like to start with secondary endpoints, is actually that it clinically works very well in comparison with Paclitaxel-coated balloons, especially if you look at the TLR rate at 1 year. We did a Kaplan-Meier estimate, and you're getting to very good results with a patency higher than 92%, and this is nearly equivalent, the curve for both groups, and also not statistically significant difference. So clinically it works very fine. And also this we can see in change of Rutherford. What is Rutherford? It's a good estimate, clinical estimate about the improvement of walking capacities of our patients. And this was actually the improvement after 1 year was equivalent between both groups. But this is clinically, we are pretty sure that both concepts are working well. But now we are looking at also at the primary endpoints, which is the efficacy endpoint and the safety endpoint. And we have 2 primary endpoints, as I said. The primary efficacy endpoint is primary patency with a pulse systolic velocity ratio less than 2.4 and no TLR at 12 months. Here we look at non-inferiority, and also the primary safety endpoint, which is a composite of clinical driven target vessel revascularization, no major amputation, and procedure and device related death. Also we are looking here at non-inferiority. Let me start with everyone was waiting for the primary endpoint of efficacy, and this is actually quite astonishing. And we had for the Sirolimus a rate of 73.8% at 1 year, as compared to Paclitaxel with 75%. So the rate difference was only 1.2%. So the non-inferiority aim was reached with a p-value of 0.022. So we can confirm the efficacy endpoint was met. And also this was true for the, which we also expected for the composite safety endpoint. We had there overall safety of 9.4% for the Sirolimus group as compared to 7.3% for the Paclitaxel group, a little bit higher in the Sirolimus group, but this was not statistically. The difference was not statistically significant, meaning the non-inferiority margin was met with p-value of 0.003. So clearly, both balloons are at 12 months as safe than the other. I think the main conclusion is regarding the primary endpoints, it's clearly both balloons are comparable in terms of efficacy as well as in terms of safety. And as I mentioned before, secondary endpoint, clinical endpoints shows really good results for both balloons. So in future you can decide for the femoropopliteal artery, do I prefer with a lower risk profile, the Sirolimus balloon, or if I go for the Paclitaxel-Coated balloon. Both options, I think, this trial head-to-head comparison means that both are comparable, and we compared against a whole group of those balloons on the European market, which have also shown 2-year RCT data, so the real good players, so strong balloons. So in the daily business, it means you have the choice, and it's up to you to decide if these results are really convincing. We are looking at 5 years follow-up. I think it's always nice to reach good results after 1 year. It's very good and promising that we have reached the same level for both balloon categories, but now we really have to see how is really performing the Sirolimus balloon on long-term follow-up. And we know that there's a late catch-up for most of the Paclitaxel-Coated balloons. People believe that Sirolimus has a longer effect in the vessel wall and might have a longer patency rates. So I hope next year at the TCT I can already present the 2 years data, and let's see how it looks like there, who is then ahead to each other. So we are looking for 5 years with 1 year intervals, and I'm really excited to see how it proceeds for the future.